Say it again.
Kylie.
Roxanne.
Riley.
Alicia.
And I'm Lauren.
Hi, I'm Brenda, and I'm going to talk about bariatric surgery with you today. Obesity has become a severe problem in the United States. There are over 5% of the American public that has obesity or morbid obesity, which is equal to about 10 million people. To qualify for a bariatric surgery, you need to have a BMI of 35 points. You also need to have some other complications such as high blood pressure, sleep apnea, acid reflux. You have to have attempted weight loss for approximately 6 months and have documented proof that you've done it, or you can have a BMI of 40 or above. Millions of people that have attempted weight loss on their own have discovered that after many times of losing weight and gaining weight, your metabolism slows down, and making it almost impossible to lose weight without the help of extreme exercise or surgery. In 1960, Dr. Mason and Dr. Ito discovered that the bariatric surgery helped them with weight loss, helped people with weight loss, after they had watched people that they had done surgery on to take part of their stomach out because of ulcers. In the last 40 to 50 years, they have increased and made their procedures much more acceptable and easier on the system. In the beginning, a lot of the problems were diarrhea and extreme malnutrition because your body is not absorbing your food the way it should. Complications of any bariatric surgery include infection, hemorrhaging, respiratory problems, hernias, bowel obstructions, and ulcers. Advantages are that you lose your appetite, you have weight loss, your sleep apnea, your acid reflux, your blood pressure, your sugar diabetes all seem to go back to normal. In 1979, gastric bypass was started to be used on a regular basis. At the beginning, most people, all people, had severe incisions from their pelvic bone up to their rib cage. They had more complications because of the excessive wound. And then in 2002, they began doing their surgeries laparoscopically. In 2005, they also began doing the lap band, which that procedure is, there's a band that's put in through the laparoscopic needle around the top part of your stomach to lower your appetite and help you to lose weight. The gastric bypass is when they actually cut part of your stomach away and attach that to the smaller intestines. But all of your stomach remains in your body. There is one more extensive kind that actually the stomach that you're not using for your food intake is actually removed. The recovery is 2 to 8 weeks. Usually after 2 you can return to work. You begin after surgery on a clear liquid diet. You are then allowed to go into a pureed food and then soft food, and then you can go into regular foods. You need to watch at all times your sugar intake and also your fat intake, and stay away from alcoholic beverages and carbonated beverages. You need to, after any surgery, stay mobile to help with blood clotting, and you also to keep the respiratory system working properly. I had the surgery done a year and 3 months ago. I had done a lot of extensive research on the surgery, I had attempted many different kinds of weight loss, and I could not lose weight. I came to a standstill. Since the surgery, I have got back out and am in the public and talking to people. I also have found myself getting into lots of pictures with my family, and I have lost 130 pounds, and I believe that that is the best thing other than my family and my children that I have ever done. Thank you.
5:30.